Thank you for joining us on Savvy Senior Sources, Talking with Experts. Let's take a moment and hear from our sponsors, GWG Life and Reverse Mortgages SIDAC.
Provide for your long-term care. Convert your life insurance towards payments for long-term care. If you are concerned about future health care, you can convert your life insurance to pay for home care or assisted living. Health problems can be stressful enough without the added burden of financial obligations. If you feel that you no longer need your life insurance policy, you may want to apply the value towards long-term care.
Hi, I'm Beth Paterson, a certified reverse mortgage professional with Reverse Mortgages SIDAC. Mike and Carol decided that they needed a one-level home to fit their changing health needs. They used the reverse mortgage to purchase their new home instead of using conventional financing. This has benefited them greatly. Barbara decided to do a reverse mortgage to pay off her conventional loan that she was making monthly payments on. She had funds left in the line of credit after paying that off. And a year or so later, when she fell and broke her shoulder, she was able to tap those lines of credit to pay for her home care. As she said, she would have been up the creek without a paddle without the reverse mortgage. If you'd like information on how to receive security, independence, dignity, and control in your retirement years, contact us. Hi, welcome to Savvy Senior Sources, Talking with Experts. We guide your way through resources A to V for seniors, boomers, caregivers, and their advisors. In addition to the show, we also publish the Savvy Senior Sources Resource Guide. You can find information on savvyseniorsources.com. I'm your host, Beth Paterson. I'm with Savvy Senior Sources as well as Reverse Mortgages SIDAC. I'd like to take a moment to say thank you to our sponsors, GWG Life and Reverse Mortgages SIDAC, for making this show possible. I'd like to welcome back my guest co-host, Mary Rempfer, who is a senior professional with years of experience, specifically in home care, and is a licensed social worker and now also a caregiver.
That's correct. Thank you for having me, Beth.
We're glad to have you back. And today's show, we are talking about fall prevention with our guest, Allison Bakke from Above and Beyond. Thanks for being here, Allison.
Thanks for having me.
Yeah. Let's start out a little bit and tell us about you and because you're an occupational therapist, and then also about a little bit about Above and Beyond.
Correct, yes. I'm an occupational therapist by background. What I do is help folks with home modifications, looking at making their environment safer, as well as working with cognitive and memory loss issues and environmental modifications and things such as that. Above and Beyond is a private pay physical and occupational therapy provider, so we help seniors stay in their home, wherever that might be, for as long as possible.
Great, and so let's start talking, why is fall prevention so important?
It has a huge impact on our society. Right now, our population is aging, and we have the boomers coming up. The first wave of them are getting into their early 70s. And falls are going to present both a serious caregiver burden as well as an economic impact on our country. So it's really important that we address these things proactively. Minnesota has the 5th highest fall rate in the nation.
Oh, wow.
And we aren't entirely certain why that is, if it's our winters, if our folks are more active, taking more safety risks, if we aren't being as proactive as we could be about some things. So we aren't really sure about why that might be, but it's something that as healthcare professionals, it's really important that we start addressing that on a regular basis with everybody we see, even if they haven't had a fall.
Doesn't it also impact returning to hospitals, or a lot of?
Absolutely. That's a big reason for readmitting into a hospital is falling after an illness or an injury, and the problems then start to compound on one another.
Allison, what are the financial burdens of falls?
Absolutely. They've been increasing over the years. And in 2009, we were looking at about $19 billion a year spent in this country. And that's the direct things we can trace. That's not necessarily looking at lost time from work for a caregiver that needs to help out at home, and those sorts of things, the cost of moving, those things aren't added in there. In 2013, the most recent year, we've had some statistics, $34 billion was spent, and the projection by
34 billion?
Yes.
Wow.
Yes. And by 2020, they're projecting over $44 billion will be spent annually.
Oh my gosh.
Just as a result of
Just
falls.
as a result of falls, 1 out of 3 adults 65 and older fall each year. They're the leading cause of illness and injury, injury and death in this age group of 65 plus. 20 to 30% of falls result in moderate to severe injuries that are going to reduce mobility and independence. And that's when people start needing more help from family members or professionals. They're starting to get to be at risk of needing to move to a higher level of care. And all those things start to compound on one another.
Just from a simple fall, it can just start to snowball and really affect their quality of life and everybody who is in the family or a family member.
Go ahead.
What can somebody do to prevent falls?
Yes. Well, the first thing I'd like to talk about a little bit is some of the risk factors for falling.
Yeah.
Okay.
And then we can kind of get more into depth into some of each of those things. But a fear of falling is a huge risk factor. So what happens is somebody has a fall or they're afraid of falling, and now they're starting to limit their activity, they're becoming less mobile, so they're losing strength, they're losing endurance, they're losing balance. They're doing things that are not as safe, they alter the way they're walking, and so they're not using a safe gait pattern anymore. So that's a big one, and physical and occupational therapists work a lot around overcoming that fear and supporting and encouraging that. Another thing is 4 or more medications is a risk factor, and a lot of our seniors are getting up into 4+ medications pretty easily.
Yeah.
Weak ankles. People don't think about their ankles a whole heck of a lot, but that is something, if you have weak ankles, you are increasing your risk of falling, and so there's exercises to look at for that. Our environment is a big risk factor, things around the home, and we can talk more about that in a little bit.
Yeah.
And then things, any chronic diseases that are going on, whether it's Parkinson's or diseases such as diabetes that are impairing your circulation or your sensation in your hands and feet, that can impact your ability to safely move from point A to point B.
And we're talking about the risks, and we just said about the fear, people develop the fear. So now we're saying, okay, all these things can cause a fear. Are we increasing that fear in them? But let's talk about some things to help that they can do to prevent the falls.
Absolutely.
So that they don't have to live by that fear.
Absolutely. And that's a big thing, to empower people
Right.
to feel like that there is so much you can do to control falls. And so let's start talking about that. Let's see, routine exercise. That's probably number one, is just getting out, getting active. And, we talked about strengthening your ankles. Those are exercises like heel raises. And it's great if you have the opportunity to work with a physical therapist to talk about, what are the most important exercises I can do on a regular basis that are going to keep me strong and improve my balance. Because there's 2 components. There's balance and there's strength. And those 2 areas both need to be addressed. So there's very targeted exercises we can look at for that.
What about home safety? There's, I know from experience too about throw rugs or different things.
Yeah.
And
Behind those throw rugs. Throw those throw rugs
I know,
away.
Absolutely.
and I have them in my home, but so far so good. But
that's, I always say that's the reason everybody loves to hate me when I come in, because I say take up your throw rugs, and everybody has great reasons to have their throw rugs. The throw rugs, if you're using an adaptive device or you're getting up in the middle of the night to use the restroom, and the light is dim or low, as we age, our vision changes. And so it's easy to get a foot caught up in a rug. And as much as we love them and as much sentimental value as they hold for us, they really pose a risk. And so that's a big one to look at, picking up and moving them out. If you absolutely have to have something in the bathroom, because it is, it's a balance between, okay, you're getting out of the shower and you're wet, OTs, occupational therapists, can come in and we can talk to you about ways to work around that to make sure you're dry when you get out on that tile or linoleum. But if you're wet and hitting the floor there, that's a fall risk too. So if there is somewhere where it is critical to have a rug, making sure that it has a rubber back on it is important. Other things around the home to think about and consider is in the kitchen, making sure that those frequently used items are well within reach. If they're on the countertops, they're in the lower cupboards and cabinets. Reorganizing your kitchen differently makes a big impact for people. And the other thing is we all love to decorate and we love to have all those sentimental things around the house. And what happens when you don't have nice clear walkways, if you do have changes in your feeling in your feet, for example, or your vision, you aren't seeing where your feet are, those are things, those little knickknacks and clutter areas, they're opportunities to get caught up and fall. I was just working with a woman on Friday with dementia. And when somebody has some memory loss going on, as it advances, your visual field gets smaller and smaller. And so she was probably paying attention to things that were maybe 12 to 24 inches in front of her face. And without fail, every time she got up, she hooked her foot on the coffee table, the end table, the chair. And so without somebody there every single time. So what we did is we took a lot of furniture out, and it made a big difference. She was now getting up safely, she was walking free and clear, and her caregivers felt much better about the situation.
And she probably felt more independent too, because she didn't have to rely that somebody needed to be there.
Yeah. And she can stay in her own home where she wants to be.
Yep.
Yeah.
With everybody using the internet and becoming experts, can a person just go on the internet and figure out for themselves what would make their home safe?
You can. I'm a little biased because that's what I do. It's important to have some good expert advice. When my physical therapists or occupational therapists, when we come in, we kind of do a disservice sometimes. We make it look easy and we just say, you need this chair. But really what goes into that and considering what is needed is really pretty complex and in depth. We're looking at all sorts of things when we're watching a senior get on and off a toilet, in and out of a bathtub, move around their kitchen. We're looking at, where are they placing their hands? What chronic disease processes are going on? And how is that impacting their movement and their safety right now? But we're also projecting forward how this disease will progress and change with time. So what happens is you could buy a shower chair that maybe works today, but you're going to end up spending more money down the road because it's only going to work for maybe 3 months, maybe a month, and then there's going to be a change. So we do some projection in what we're looking at so that we can try to hopefully save some money in the long run, both in fall cost and emotional pain and suffering, and also in investing in equipment. But it's a trial and error.
Talk a little bit about your background, what goes into occupational or physical therapy to give you that expertise versus just me who has been in the senior industry and have heard these things, but I can't walk into a home and other than seeing throw rugs on the floor to say that might be a risk.
Right. Well, occupational and physical therapists typically at this point in our field hold either a master's level or doctorate level degree. Wow. And so with that, there has been a lot of training in, I took semesters of classes on home modification and adaptive equipment, and then overlaying that on top of the disease processes. So they're taking classes in kinesiology, anatomy, pathology, pathophysiology, things to really understand that complex interplay between how movement happens and how it works, and then what's the impact on function for the senior. So I feel like that's, again, I'm probably a little biased, but I feel like that's a really unique educational base for being able to help seniors and really accomplish what they're looking to do, which is staying in their home.
Yeah.
And how does one find someone to come into their home to do a home safety evaluation?
Yeah. If somebody is qualified, if they've had a recent fall or they're in seeing their doctor, that's a great place to start, is asking him if you could have a physical therapist or occupational therapist come out to your home through your Medicare or your insurance company to see if they could come out and assist you. Medicare has some guidelines about, who would qualify for that and who doesn't. Where my company comes in is we work with those folks who maybe aren't qualifying for their Medicare services. So they're being proactive and looking for assistance before something happens, which is really the best time to do it.
Right.
And really the prevention versus
Absolutely.
Prevent the crisis,
reaction.
which
Yes.
we know can be so hard.
Yeah.
Versus the reaction of I've fallen and then gotten in. So are your services, you'd mentioned some are paid by Medicare, but then primarily private pay?
Yes, my services are strictly private pay. If somebody has long-term care insurance, that will cover it at times. But Medicare, there are other great providers out there that would be able to, and usually the doctor's office will have several options for their patients to be able to tap into.
Other options are sponsors, of course, life settlements, which is converting life insurance policies into cash. If somebody has a life insurance policy and they no longer need it or can't afford the premiums, rather than just not paying those, it's an option to get cash to pay for private pay services, reverse mortgages if you're in your home that you own. Is an option to also access cash to pay for services to bring in.
It's a great benefit.
So,
Investing, over the years I've worked with so many seniors who they don't want to tap into those resources, right? They're saving it for a rainy day when that cloud's right overhead.
yeah. So, and again, what's better than the prevention of, and if you need the money to do that, so those are options, and prevention in the private pay.
Yes.
So you don't have to.
Right. Allison, you were talking about how Medicare covers the services, but in my experience, Medicare's coverage in the home for therapy is really short-lived and intermittent.
Yes.
Can you speak a little bit to that, about what can happen or what a person can do after Medicare is done paying for that?
Yeah, after Medicare is done, utilize those services, take advantage of them. The hardest thing, and the reason I started my company, was the fact that I saw those Medicare services coming in. They were intermittent, they stopped, and then once they went away, that support structure went away.
Sure.
And people were not following through with the exercises, and they were not keeping up on those things. And so that's where I developed Above and Beyond, to be able to fill that gap and to fill that need and to continue to maintain strength and balance and wellness for folks. So we're working with people on that, and the private pay companies out there are able to fill in that need once the Medicare support goes away. Because as I said, there's guidelines and restrictions, and you have to be homebound, and it's very short-lived, and not everybody falls into that parameter.
Right.
And private services in the therapy world are not as well known right now at this
So
point.
true.
So it is harder to find. You kind of have to know somebody, or hopefully some of the professionals and support services you already have in place have an awareness about it. And shows like this help raise awareness so people know that they have options available to them to bring extra support and to maintain that strength and endurance and balance that they've achieved through a hard-fought rehab battle.
Right.
You don't want to
Right.
lose that right away.
And still keep their independence
Yes. Yeah.
and feel
Yeah.
very
Yeah.
much empowered.
Yep. And really, we like to focus on function. So the goal is, what can we get you back doing again?
Right.
You don't have to lose everything. If fishing is important to you, if riding your bike is important to you, how do we do that? It maybe doesn't look like 10 or 20 years ago, but how do we do those things again? And all of that plays into preventing falls.
Right,
you know?
right. You know, I think the statistics you were sharing earlier are so important because I think, like I'm looking at my dad, he does not understand the need for that. But when you start putting a dollar amount on the situation and that preventing a fall is so much better than going through a fall because you might not be able to get back, excuse me, to the same place you were before.
Absolutely.
And then you might not be able to return home.
Yeah.
Right,
So-
yeah.
The risk for institutionalization after a fall skyrockets, and you get into that 75 plus age category, and you know it really goes up, and your risk of beyond illness and injury, death goes up significantly, and that's not a good way to it's not going on your terms.
Right,
It's,
right.
you're losing a lot of function and
Right.
those sorts of things.
And this way you're really taking a little more control of your life
Exactly.
rather than
Yeah.
having it the other way around.
Yeah. Yes.
Yeah. It comes back to that being empowered and having
Yes.
that,
Yeah.
making the choices and where you want to live and how you want to live your life,
Yeah.
and you don't have to give that up. Let's come back to some of the things to prevent falls. Footwear is something else that can be a big impact.
Yes, especially with women. Women like to have fun shoes, right?
You're not getting our shoes in on this, are you?
You won't look
We
at
don't,
your
we
shoes.
don't.
I'm wearing sensible shoes. Shoes with a flat bottom that provide a lot of support and structure around the ankle. Those are your best shoes for walking around. And in the Midwest, we're taught to have manners and leave our shoes at the door. As we get older, wearing that tennis shoe throughout the day, wearing that slip-on loafer during the day helps give you some extra support as you're walking around your home or you're out on uneven surfaces out in the community. And fall prevention just doesn't happen just at home. It's important to think about it in terms of, am I safe when I go out to the grocery store? Worked with a lot of people over the years where slips, trips, falls have happened, in the produce section when you're reaching way back for something, or you've got the uneven sidewalks.
How do you feel about slippers, Allison? My dad wears slippers and I'm just like, you are gonna fall, I know it.
Yeah. There are some that are great, and
Okay.
then there are some that are horrible. So it's hard, but that leads into another point. Things are so personalized. There is no one cookie cutter solution for everybody. So for one person, a good supportive slipper is very good. But depending on what's going on with your dad, how strong he is or not strong, we may say your slipper's okay to wear at this point, but not right now. Or let's get you stronger and then we can wear this. Or here's an alternative slipper that would be safer for you.
Okay.
Again, anything that's more substantial and has support. I see a lot of seniors wearing broken down backed slippers.
Yeah.
Those aren't safe.
Yeah, in my situation, my parents, if it's coming from me, they're like, oh yeah, I need somebody like you, Allison, to come in and say,
Yeah.
no, you can't do that. Because they always take that kind of information better from an outside professional than
Right.
their own daughter or
Yeah.
son.
And that's a great point too. Talking about family dynamics and interpersonal relationships and preventing some of those power struggles, sometimes turning those over to another professional. It's the same, they'll take that information and they'll run with it. And it's
Right.
okay, And the other thing is, I go away. I don't have to, I can take the throw rug and leave, and they can not like me for a long time. But as the daughter or son, you have to be there every day, and it's not real productive to have somebody mad at you when you're trying to help.
Yeah. In our last minute here, I want to touch on one thing. Is there any one piece of equipment to help seniors be safe in their home?
Your brain is probably your best piece of equipment, really. There is no one piece of equipment that's going to prevent everything because we're all unique individuals and we have different chronic diseases. We're aging differently. But you want to look at what's happening for you personally and make smart decisions about going back to controlling what you want your destiny to be for aging.
Great. So you're in control. Make decisions, reach out to the professionals to get that help, the experienced professionals in
Yes.
this industry, not just off the internet.
Yes.
So lots of good information. Thanks for being here,
Thank you
Allison.
for having me. I
Again,
appreciate
Allison
it.
Bakke from Above and Beyond. And the information is on the bottom of the screen. And again, thank you to Mary Rempfer for being my guest co-host today. Savvy Senior Sources, don't forget to reach out to the website, savvyseniorsources.com, for information on resources and the guidebook. And a last thank you to our sponsors, GWG Life and Reverse Mortgages SIDAC, for making the show possible. Thank you.
What is the secondary market for life insurance? The secondary market for life insurance is an emerging financial market that provides individuals options with their policies. These options allow policyholders to benefit from the value of their life insurance. Policies are sometimes a financial burden, especially for seniors, as premiums often increase over time. The secondary market offers financial alternatives that can help policyholders benefit from their life insurance now.
Hi, I'm Beth Paterson, a certified reverse mortgage professional with Reverse Mortgages SIDAC. Bob's wife passed away, meaning his Social Security income was cut in half. His financial advisor suggested he look into a reverse mortgage. With the reverse mortgage, he was able to take a dream vacation with his nephew, and oh, the stories that they can share. After Bob passed away, his niece shared the difference that it made to the whole family. Dorothy did the reverse mortgage in order to protect her other retirement funds. With her line of credit, she was able to travel, buy a new car, and do home repairs. Years later, she's still benefiting from the reverse mortgage line of credit and not having to rely on her children. For more information on how you too can have security, independence, dignity, and control, contact us.